Hello everyone, you're watching sqadia.com and I am Hamad Hatter. Today our topic is management of trauma patient. In this we'll have 5 sections as usual, and the first section will be going through the pre-hospital management, that is what are the role of emergency medical services and how they actually, what are the causes of major trauma, what is called as safety on scene, and what is the immediate action which needs to be taken. In the second, we'll be going through the initial assessment, that is awareness recognition of injuries, that ARM, and then its management and how actually the emergency medical services manage initially the airway and they secure the cervical spine, then the breathing as well as the circulation. And that is why it's important, because in most common injuries either towards the airway or the breathing, or then it comes the circulation. And then in the next section, we were discussing briefly the hospital management, that what is the role of a trauma team, how the organization is actually done at the hospital level, how the trauma teams are formed, what is the primary survey, what is its adjuncts to primary survey, then what is secondary survey and other causes. Then from secondary survey, once we have completed our primary survey, we move on to secondary survey, and once we're done with the adjuncts to secondary survey, we either reevaluate and refer it to the if it's already a level 1 trauma care center, that will probably refer to the definitive unit which would be responsible for the patient. But if it's not the level 1 trauma center, then probably it can be referred to the definitive place where the definitive management can be taken place. In the last section, we will be briefly going through the pain management which is associated with the trauma care, and we will be going through what are the different intravenous and inhalational anesthesia, what are nerve blocks, and what is the definitive care, especially when mobilizing the patient to a different facility. Thank you very much. Keep watching sqadia.com.